Welcome to the League of Women Voters of Lee County's Health Committee panel presentation, Lee County Behavioral Health Community Issues and Partnerships, the 20th Judicial County Behavioral Courts. Our panelists today are Judge Andrew Swett from the 20th Judicial Lee County Behavioral Courts, Lieutenant LaDonna Brady, Lee County Sheriff Reentry Programs, and Philip Brooks of Castle. I would like to introduce our first Vice President, Sarah McDonald.
And welcome to the first general meeting of the League of Women Voters of Lee County, brought to you on Zoom. I am Sarah McDonald, Vice President of the County Board, and I'm standing in for Clara Ann Graham, our President. The League of Women Voters is a nonpartisan political organization that never supports or opposes candidates and never supports or opposes issues that we have not studied and reached consensus on. Today's meeting is in the area of behavioral health, and I'd like to introduce Patricia Salab, our board member, who is in charge of this subject.
Thank you, Sarah. Our health committee's focus for 2021 is exploring behavioral health organizations providing services throughout Lee County and the additional challenges they may be facing during a pandemic. Today's program, Lee County Courts and Wraparound Services Community Partners, focuses on the unique partnership of three organizations: the Lee County Behavioral Courts, the Lee County Sheriff's Reentry Program, and Castle Community Assisted and Supported Living, Inc. Their leadership, determination, and collaboration in serving those most vulnerable in our community is inspiring. The National League of Women Voters behavioral health positions for this panel presentation are access to safe and stable housing for people with behavioral health challenges, including those that are chronically homeless, effective reentry planning and follow-up for people released from both behavioral health hospitalization in the criminal justice system, problem-solving or specialty courts, including mental health and drug courts in all judicial districts to provide needed treatment and avoid inappropriate entry into the criminal justice system. And lastly, efforts to decrease the stigmatization of and normalize behavioral health problems and care. We are very excited to share with you our previously recorded virtual program, and I would like to introduce our moderator for the panel discussion, Lauren Harkins, and Lee County Judge Andrew Swett. Lauren works for Mothers Against Drunk Driving as a South Florida program specialist, facilitating prevention programs to over 15,000 students and parents annually. Lauren partners with law enforcement, school districts, public health, and prevention partners throughout Charlotte, Collier, Hendry, Glades, Lee, and Miami-Dade counties. She currently serves on the Collier County Community Drug Response Team and is a presenter for the Lee County Sheriff's Teen Driver Challenge program. Lauren's lifelong commitment to diversity, equity, and inclusion began at the age of 12 as a graduate of the Rosa and Raymond Parks Pathways to Freedom program in Detroit, Michigan. She's currently obtaining her Bachelor of Science degree in web design and is an active member of the League of Women Voters of Lee County Health Committee. Judge Andrew Swett was born in Jacksonville, Florida, and graduated from Jacksonville University in 1986. He attended the University of Florida College of Law and graduated in 1989. He began his career as assistant state attorney right out of law school here in Fort Myers. In 1995, he went into private practice with the firm Knott, Evelini Hart, where he practiced criminal defense and civil litigation. The judge left the firm in 2011 after being appointed by Governor Scott to the county court bench. Judge Swett has taken over the mental health court docket and one of the drug court dockets. He was also instrumental in beginning the new Veterans Court docket. Judge Swett has been active in our community since his arrival in Lee County in 1990. He's served as the president of the Greater Fort Myers Soccer Club for over a decade and served on the board of Christian education at St. Michael's Lutheran School. Judge Swett has also served on the board of McGregor Clinic. He was a member of the Kiwanis Club for several years as well. Judge Swett is currently serving on the board of NAMI of Lee County, the National Association on Mental Illness, as well as a member of the Rotary Club of Fort Myers. Judge Swett co-chairs the Lee County Ad Hoc Behavioral Health and Substance Use Disorder Steering Committee and will begin our program by telling us about the committee's history and progress.
Good morning, everyone. And good morning, Judge Swett. Thank you for your time today and the opportunity for our members to learn more about the Lee County Behavioral Court programs. My first question is going to be, can you tell us the difference between the traditional courts versus problem-solving courts?
Yes, good morning, Lauren. I do have a slide I'd like to share. So good morning, everyone. My name is Andy Swett. I'm a county court judge. The treatment court, I've been involved with the treatment courts for several years now. And the question is, what's the difference between the courts? The treatment courts or the problem-solving courts are courts that aim to reduce recidivism rates in the special populations, those with mental health and substance abuse issues. And what we try to do is we try to stop the cycle of arresting people with mental health issues. When people with mental health issues, if you bring them into the regular court system and you just punish them, most of the time, you're not going to solve the problem. The problem is their mental health illness. So the difference between the traditional system and the mental health, the treatment court system, is that we're trying to solve the issues that they're having because of their mental health issues. And if we do that, they'll stop committing crimes. The way we do that is we link everyone up with all the supports and the resources they need in the community to improve their overall quality of life. And that will reduce the chance of them committing criminal acts. And what we do provide is we have other people here today who will help me talk about this. We provide treatment, medications, case management, housing, financial support, including employment training and benefits. We develop positive support networks that will help them through support groups and also recovery groups. So that's
great. Thank you. Our next question is going to be, what has been the impact of COVID-19 on the court activities over the past year?
Well, the impact it's been on the overall court activities is we're almost doing nothing. We have, for a couple of months now, slowly started doing things more, but criminal trials, we do one judge does one trial once a week. In a normal week, when the world was revolving and everybody was doing everything, we'd have probably 7 or 8 trials going on any day, 4 or 5 days a week. Now we're able to bring in one jury at a time and try one case at a time, which has slowly or severely hampered our ability to resolve cases. Our system, both civil and criminal, is based upon being able to resolve cases. If we cannot resolve cases, then the system is going to break down. So now that we're doing one trial a week, the fact that we have a trial does cause people to resolve cases. So that is helping us slowly start to resolve cases. Specifically for the treatment courts, it does really the same thing. People who are coming into the treatment court sometimes don't take that opportunity to come into the treatment court because they're not forced to resolve their case. And coming into the treatment courts is a voluntary thing. Let me get off this. It's voluntary. So the other thing that the treatment courts do, the in-person contact is very important, because one of the aspects of treatment court is that a judge is involved in every aspect of it, because it has what we call a black robe effect. The participants in the treatment court see a judge, a person in a black robe, someone who has power over them. And I try to show that I care, that I'm interested in what they're doing and the things that the requirements I have them do. I talk to them about it. I ask them how their week is going. If they're doing the things they're supposed to do, how is their family? And that someone in a position of power showing that they care has a good effect on people who are in the system. So now, much like today, when there's, I don't know how many, 30, 40 people are here, everyone gets to see me in this little box. I do wear my robe, and it just doesn't have the same effect as being in person. So that has a detrimental effect on the treatment courts. Another thing, is when you don't do what you're supposed to do, I can sanction you. And when I'm sanctioning people and they're on Zoom, when I say, okay, I want you to report to the jail in 3 hours, it doesn't have the same effect as when I go bailiff, bring them to the jail. So it doesn't, doing it on Zoom, I like Zoom. At least we're able to have contact. There are meetings that occur and treatment can occur through Zoom, but we need to get back into the courtroom.
Thank you. So our next question is going to be, what are the problem-solving courts requirements?
All right. The requirements, first of all, I'm just going to go through mental health qualifications. What are the qualifications to get into mental health court? First, you have to have an eligible, severe, persistent mental health illness, schizophrenia, anxiety disorders, bipolar, major depressive disorders. It can be dual diagnosis, meaning you could have a substance abuse diagnosis as well as a mental health illness. And you must be willing to participate. As I said earlier, getting into a mental health court is voluntary. We don't force you to come into the court. You can go through the regular court system. If you volunteer to come in and you qualify, then you can get into it. So when you come into mental health court, you have to take your medicine. In the real world, when your doctor tells you, I want you to take this medicine, you can tell the doctor no. In mental health court, you cannot. If a treatment or a medication is recommended, you must do that. We also provide case management, which is somebody that oversees the participant and makes sure in all aspects that they're doing everything they're supposed to do. Obviously, you got to be 18 years of age. You have to have a pending case in the 20th Judicial Circuit Well, for here, it's Lee County. Although that has expanded, we do take transfers from all over the state. You must be competent to proceed, meaning you're not insane, that you could go to trial on your case. Because if you come into mental health court, most of the time you plead to the case. We look at the charges and we make sure we don't take serious or violent offenses. That we have expanded that. We do take some more serious charges as long as I'm comfortable that we can make sure that the community and everyone who's working in the program is safe. You must be accepted by the judge who runs the program. So the participants, I call them participants, not defendants, although they are defendants in a criminal case. The participants must attend regular court appearances. It's either from once a week to monthly. The longer you're in the program, the better you're doing in the program, the less often you have to come see me. But I am in court every week talking to the participants in my mental health court. You must follow all recommendations of the court supervision plan, including taking your medications, seeing your doctors, going to treatment, going to AA meetings, being drug tested. Everything that we have recommended that you do, you're required to do it. You must attend weekly support meetings, NAMI, National Association for the Mentally Ill, the VA, AA. All those support groups are wonderful partners for my court. You must attend them on a weekly basis. You cannot do drugs or drink alcohols or any mind-altering substances, even legal substances. You can't drink alcohol. There's a new drug out there called Kratom and others whose name I can't remember, Tiana. Some of these things are legal. You cannot do those while you're in mental health court. You will be randomly and frequently tested for drugs and alcohol. You must refrain from all illegal activity. One of the things about mental health court, one of the things we do is we give chances. No one is perfect. As long as you're not committing crimes or serious crimes, then I'll give you a chance. But the quickest way to get kicked out of mental health court is to commit serious illegal activity. You must demonstrate that you are progressing towards the goals of the program. If you're just spinning your tires and not progressing, you and I are going to have a conversation about whether you're going to stay in court. There are also legal requirements, your probation requirements that you have to comply with, and all other goals have to be done. If you owe restitution, you got to pay restitution. Parenting classes, substance abuse classes, and things of that nature. All of those things are requirements of the participants.
I have a quick question.
Sure.
What if the client does not have health insurance or cannot afford their medication or the classes that they are required to. Does the court system have something in place where you can use local services to assist that person?
Yes, that is probably the majority of the people in the court system. You know, we have Medicare and Medicaid, and we have organizations in town who provide services that don't charge the participants. So we have all kinds of services. Lieutenant Brady from the Sheriff's Office, the reentry program at the Sheriff's at the jail, they don't charge anything for their services. Castle with Mr. Brooks, they provide housing for people who need housing, and if you don't have money, that's not a roadblock to getting in their program. They're going to help you get into housing, help you get a job so that you can pay. So there's all kinds of services we use, and the court system has funding from the state to help with the cost of the participants' participation.
Patricia, do you have their bios ready so we can transition to the next part for our panelists?
I do. Actually, I'd be happy to introduce Lieutenant LaDonna Brady. She has been with the Sheriff's Office since 2007. Currently, Lieutenant Brady is in the Services Division, overseeing reentry programs, education, chaplain services, special projects, and the day work program, as well as contracts. Lieutenant Brady earned her Associates in Arts and Security Administration and is a certified jail manager. She's actively working with community partners to overcome issues faced by those leaving incarceration, returning to the streets. And also we have PJ Brooks, who is with Castle as the COO of the Community Assisted and Support Living programs. Philip Brooks is an accomplished behavioral health executive and forward-looking strategist with over 30 years of providing leadership and development of programs that assist people in the need of intervention across a broad continuum of care in multiple environments. Philip is a highly respected subject matter expert in the field of behavioral health. He's a proven communicator from the boardroom to the front desk and into the community, a roll-up-your-sleeves leader whose coaching style develops employee loyalty to the organizational mission and vision. So thank you both for joining us, LaDonna and PJ Brooks. And LaDonna, congratulations on your promotion to lieutenant as well.
Thank you so much. I appreciate that.
Our next question that says, can you please tell us about the wraparound services model and the treatment team that you and your community partners do?
Well, you know, treatment courts and what we're here to talk about everything we do is providing wraparound services. And maybe Mr. Brooks can help me with this a little bit.
Sure.
Wraparound services are just all the services an individual needs with mental health illness to help them be happy, successful people in society. And that's what we, you know, the criminal justice system is to stop people from committing crimes and to be able to live a happy, contributing life in society. So I could go through dozens of entities in town who help us provide those services. Centerstone, Salus Care, or treatment providers. Lee Health, which we talked about earlier. AIM Target is a place that does provide some services, as well as drug testing. TLS is our drug court treatment provider. The Veterans Administration provides services for our veterans. Castle, which PJ is a part of, Lee County Sheriff's Office, State Attorney's Office, Public Defender's Office. The Lee County government provides services. Kimmy's Place is a recovery place for people with substance abuse issues. NAMI, which I talked about earlier. FGCU, we have professors from FGCU who are helping us reevaluate transportation issues around town for people who don't have their own type of transportation. We're trying to make it easier for people who are who have mental health illness to get around town to get all these things we need, as well as our Lee County School Board. PJ, can you add anything to that?
Yeah, if you imagine that really what it is the court is the center of the spoke of a collaboration of agencies that work with the participants within any of the treatment courts or problem-solving courts, as they're called across the country. What you look at is that the court administration, in partnership with Judge Swett, establishes contractual relationships with partner agencies that provide the clinical support and the other support services as needed. And then for the other services that are not funded, whether it be through a partner through Central Florida Behavioral Health Network, who is our what's called a managing entity that takes the funding from the State Department of Children and Families and then allocates it and supports programs such as the treatment courts, mental health court, veterans court. And what they do is it literally is a model of engaging the agencies, having points of contact so that everybody is ensuring communication in a timely fashion. Because I can make a referral and then I don't know what the hell happens, and then it gets in front of the judge and no one knows how to explain it. When it's actually what needs to happen is everybody's communicating, because the clients really aren't in it. Many of them are coming into the court. They're not in a position with their mental health concerns and issues where they have the capacity to fully comprehend and understand what's going on. And what's happening is everybody's working on their behalf to move them so that they move towards independence and or to the level of stability where we know where they're achieving and maintaining on their medication and or in the services that they are receiving. And then there are times when they may have a sanction from the judge, and judge, you can explain this a little bit better than I, but they may have to, historically, they may have to go into the county jail for a day or two. And it's more often than not, understand this, it's because their behaviors are in the community a bit out of control, and it's really about bringing them back in so they can kind of get them re-upped again and get them really kind of under control, for lack of a better way of putting it, give them a chance to settle back in and then bring them back out. The idea is not really to arrest them again. The idea is to keep them out of the system and move them towards health with the supports of the agencies.
If they go into the system, do they go into general population or do they go into the mental health wing that the jail has?
I can speak on that a little bit. It's really dependent upon their mental health status. We do have a mental health wing, and we do have step-down units. So we have specialty housing in the facility to accommodate any types of person. But what I wanted to kind of point out, and I think Judge Swett as well as PJ kind of touched on it, is one of the things with treatment courts that we have to realize is the judge speaks of, he puts mandatory medication and they have to take their meds and they have to do this. But it's really for the person, if you think about it, because these individuals in some cases may not be on their meds, but now that they're required to do so, we're actually helping them for that point, because now they are med compliant and they are staying on that medication, where in normal circumstances, if they didn't have those sanctions in place, they may not be med compliant and they may be falling back into a cycle of an issue that they couldn't handle. So it's really for them, although it is mandated by the court, it's actually for the defendant or the participant.
That's great. And my last follow-up question on this conversation before we shift gears is, do you have one person in specific besides Judge Swett that works with that client to help them reach out to the services, or they can go to them if they need help, so that way they don't need to wait till they appear in front of the judge again? Or is it up to them?
No, I have all kinds of support staff. Our treatment providers, I have Centerstone does my treatment and case management for the mental health court and the veterans court, and TLS, run by Tanya Slater, who I've known for 30 years. She's my treatment provider for drug court. And then the court system, the AOC, the administration of the court, we have case managers who work for the court, who keep track of everyone and know what they're doing and they're not doing, and help connect them with the different services they need. So we have many people. We need more, but we have many people helping connect the participants with the services they need. And the Veterans Administration, I have a VJO, a Veterans Justice Outreach Officer, who helps connect the participants with the services they need. So we do have people who help connect the participants.
That's great to hear.
Well, someone asked me, Janet Ortenzo asked me, are victims of human trafficking among those that you see coming into treatment court? And the answer is yes. I have had several participants over the years. I've done it for about 10 years. I've had several participants who have been victims of human trafficking that have come through my treatment courts.
Do you have any other questions that are in your chat box?
No.
Okay. And everybody, please feel free to send them in and we will answer them. Okay. So we'll get to the next question. Judge Swett, can you tell us about the 6-year plan and strategy for problem-solving courts?
Your mother and I were talking about that, and I have all these dreams of treatment courts. What I would like to start other treatment courts. I'm trying to start juvenile drug court, restart juvenile drug court, and we were cooking pretty good, and then coronavirus happened, and it sort of just stopped it in its tracks. So it's sort of on a side burner right now. Truthfully, a lot of services that we're providing may be cut right now because of coronavirus, but I hope within the next 6 years to be able to restart our juvenile drug court and start a juvenile mental health court. I think those are vital. The thing about the treatment courts, we catch adults when after they've committed crimes, and they're sort of a long way down the road towards having serious criminal offenses and not being able to handle their mental health issues. And while there are many people with mental health and substance abuse issues who don't commit crimes, I see the people who commit crimes. That's my interaction with them. So I want to start interacting with them sooner. And what better way to do it than the people who are being charged with crimes in juvenile court. So I'd like to restart juvenile drug court and start a juvenile mental health court. I'd also like to start a shoot-off of that does a lot more of diversion, meaning that if you complete one of our treatment courts, then your criminal charge is dismissed, rather than have you convicted of the crime and that stays with you the rest of your life. For the appropriate cases, I'd like to have more cases go into diversion, which means if you complete the court, the state attorney's office will dismiss the case. I'd also like to start a family drug court and mental health court in our, we have a unified family court, meaning anybody who has a criminal or a civil case in a family, then all those cases go in front of one judge. I'd like to start treatment courts for those courts so we can help the families. Obviously, I'd like more buy-in from our community partners and the government. This is a bad time to ask for money, and I am not asking for money because I'm not allowed to, but we certainly need more resources to do what we need to do. Lieutenant Brady or Mr. Brooks, y'all have anything to add?
Just that, as the treatment courts is a model that's proven effective, because one of the things that happens is as the judge alluded to, the black robe phenomena. Individuals that go into treatment courts often have had experiences in other treatment programs, but didn't respond because of they did not have the authority figure that they were able to respect and listen to. And the judge represents that. If you look at the research, that it shows that individuals who complete treatment courts, when they say what was the most important value of the system, even though they're confined in their treatment and other things, they say seeing the judge and knowing that he cared and made a statement, and it's that father figure, in many respects. And those of us, and I've been in the treatment field for 35 years, and I've had the opportunity to supervise treatment courts in Sarasota County off and on for 20 years. That's really what we see, and recognizing the value of that. And again, it's not intended to be a court proceeding, though it is handled that way. It is really, as the judge said, we're trying to provide a control mechanism for people to get the help they need so that we can help them find stability, because otherwise they're not finding it themselves. And that's the part that Lieutenant Brady was alluding to, that they don't have, we could say, well, you have the right to make your own decisions, but to what extent, and to what damage are you doing to yourself and potentially to others? And the idea is we help them when they aren't able to help themselves in many ways.
I will just add to that. I see the back end of that, so the robe effect and the accountability aspect. So if there is someone that does come in, what we find on our end inside the facility is that there's someone that does come in and they go see the judge and he sanctions them to come in to spend a day. You know what, you failed at this aspect, so we're gonna put you in and you're gonna go think about this. One of the things that they always tell us is that they can't believe that they disappointed Judge Swett. That's the thing. So there is truly an accountability and a father factor, and they're just like, I can't believe I messed up, and he did this for me, and he's trying to do this, and I had to go in and face him. That you can see that there is truly that accountability when they're not upset that they disappointed their family, but they're truly upset that they disappointed the judge. And that just shows you how truly it does work. Like, that factor does work, and he is making a difference for sure.
Thank you. So just to bring you up to speed, Judge Swett, from Kathy Mayo, how do you ensure that the provider agency actually provides the services that the court assigned to them?
Well, I meet with all my treatment providers every week. We have a staffing before we go to court where the participants show up, and we talk about every participant who's on the docket that day. And I'm able to ascertain what they've done and what they haven't done and what their plans are for what they're going to do the next week. Then I talk to the participant and I ask them how everything's going. And if they give me some indication that something's not happening that should happen, then I talk to the person who's supposed to be doing it to make sure it happens. So I oversee everything. I have people who work for me who also oversee the treatment to make sure that the people are going to their meetings, that the meetings are occurring, and that the participants are getting the services that they need.
Right, great. And Janet Hoffman and Crystal Johnson asked similar questions. So why isn't attention deficit disorder diagnosis not included, as well as PTSD? But I do believe you did say depression and co-occurring with substance abuse is included for mental health court.
PTSD is included. ADA, I don't think I've had anybody with ADHD. BJ, can you answer that question?
Yeah, what we run into is usually what happens is, and actually you're even covering it in your question itself, attention deficit disorder, by the time they're expressing in the court system, they have gone beyond the scope of typically the attention deficit disorder, hyperactivity disorder diagnosis, meaning that, yes, they may have that, but they're also presenting with an additional, more severe diagnosis. Okay, and you're right. And actually, what the judge is alluding to, maybe if we're able to get to that point where we're having a juvenile court of some kind, especially on the mental health side, it is likely that we'll be able to look at those diagnoses that are early onset in adolescent years, such as ADHD, which is often where it presents first, that we could look at those kinds of things, I think. But usually it's because of something more severe that they present with. And you really are alluding to it, that really becomes the preponderant issue. Now, if they're being diagnosed and the treatment provider, the clinician and the psychiatrist see that it's an appropriate issue, they will look at it. But you have to be, one of the challenges you have within being in a treatment court is also some of the medications are mood altering. The Adderall and the other Ritalin and other drugs like that could be, actually what we've seen is individuals will not take them, but sell them. And we have to be real mindful of medications not being abused in that way.
So I am I guess, executive sponsor, it says on here. Truthfully, it was Lee Health, Dr. Paul Simeone, who's the vice president medical director of behavioral health at Lee Health. He asked me to help participate in this program, and it's just a subcommittee to come up with the gaps in our community for people with mental health and substance abuse issues. And that when we have several subcommittees on this subcommittee that are doing different things. The subcommittee I'm on, it's court programs, but really we're focused on people coming back into the community from the jail, as well as providing housing for those who are high utilizers with high need. High utilizers mean people are in and out of jail because of the mental health illness. They get arrested for minor crimes. They go into jail. They spend a few days, a couple of weeks, and then they're right back out on the streets with no job, no house, no treatment. So we're trying to provide that. And PJ works for Castle, and I'm going to let him talk about it. but PJ has a program for those people. We have a demonstration project that we're doing, and Lieutenant Brady is in charge of the reentry program at the jail, so that we start people on a good step when they get out of jail. We just don't let them out of the jail, or we don't let out people out of the jail now. We let people out at the court facility on Ortez. We just don't kick them out in their pajamas and tell them good luck. So PJ, you want to talk about our demonstration project? Sure.
One of the things that we've been trying to look at is one of the key factors that happens for many with mental health issues is if they don't have stable housing, it's very hard and difficult for them to be able to maintain any of the other. How do you show up for your doctor's appointment, your psychiatry appointment, or whatever it may be if you're homeless and you're wondering when you're going to be wherever you need to be? And Castle, we are a permanent supported housing provider in Southwest Florida. We're actually in 7 counties. And in Lee County, we have a number of home housing units, whether scattered housing, and we actually have one that's going to be opening in June called Cypress Village near, Colonial and, I just went blank. Anyway.
Winkler,
thank you. But the demonstration project, we, Castle committed 2 beds to work on a pilot where we would take individuals that meet that high need, high utilizer category that are entering into jail, and we're trying to turn them back around out of the jail and back into the community with our case management supports and also access to care through Lee Health for their mental health needs, Salus Care for their substance abuse needs if they're present, and then working on a number of other issues. And with the and the intent is again very small scale, an N of 2, but the goal will be to add more beds to this project so that we can work on. They'd be better served if we could get them into stable housing and provide the wraparound supports and get them connected rapidly rather than having to follow through their course of care. And actually, I should give credit to the Public Defender's Office as well, Kathy Smith and Nicole Calderon. They're instrumental in looking at potential candidates that they can try to work through the courts to get them out faster. So that's what has happened in both of these cases that have so far proven fairly successful. Our one client is actually going to transition out of the program because he's going to sign a permanent lease with us. So that'll open up for the next candidate. And the other participant has had some challenges, and we expected things like this to happen. But instead of that person going to court, we have been able to secure a commitment for a long-term residential treatment bed with a treatment provider in Sarasota County through Department of Corrections, because we're also working with felony probation, who oversees one of the clients as well.
Yeah, let me add something here, PJ. The male individual Mr. Brooks is talking about is an individual who I've known for 30 years. When I first met him, when I was leaving the courthouse as an assistant state attorney, it was cold outside, and I saw him climbing the jail fence downtown, and I go, "Hey, what are you doing?" He goes, "It's cold. I want to get into jail." And over the past 30 years, I've seen him. I've prosecuted him. I've never defended him. I've prosecuted him. He's been in front of me in courts, and he's just, I want to say thousands. It's probably only been hundreds of times, but he's been, over the last 30 years, he's been arrested at least hundreds of times. He goes to jail when he's cold. He goes to jail when he's hungry, and he just goes in and out of jail for the last 30 years. Since Castle has housed him, and I learned something today. Since Castle has housed him, he hasn't been arrested, or he's had interaction with law enforcement, but has not been arrested since he's been there. And now he's made it from the first part of the program, where now he's signing a lease and he's going to live there permanently. So the program to me is already a success. So Lieutenant Brady, what about the reentry program?
What we strive to do, and like you guys said, they're in and out of jail, and we're focusing on trying to get them stable in the community so they don't come back. It costs the county millions of dollars. I mean, honestly, if you think about all the services, and that's what the high need, high utilizer is, as far as hospital care and all these things, because like the judge said, these people, when they need something, they're either going to go to the hospital or they're going to try to come and get arrested and come to jail because they want that comfort. They need food. They're cold. But what we do is we have a team of people who work at about the mark of 60 days. So when they're getting ready to be released at about 60 days out, we start working with them, trying to find them permanent housing, trying to find them treatment programs, whatever the case may be. We do employment applications. We do anything that we can possibly do to try to get them on their feet prior to leaving. There's a whole realm of things that we want to make bigger and better, but COVID has obviously put a little bit of a damper on that, but we're not going to let it hold us down. But they do work with these individuals to assure that we provide them, we get them ID cards and driver's license if we're able to. We apply for their birth certificates. We apply for their social security cards. We try to, anything that we can do to help them on the outside, because it is very difficult. And there has been, for anyone to do anything, can't get a job, can't do anything without an ID. You just can't do it. And most of these people do not have this. So we were, before COVID, the Department of, we had Flow. So basically they came in, Florida Licensing on Wheels, and we would actually, so far we've gotten about, I think our stats are a little over 300 right now, 300 identifications to inmates, totally paid for by either donations from the community or the sheriff's office. So these individuals have one step closer, or they have that rung there so they can actually go and apply for a job. Right now, we don't have Flow coming in, but we are doing it. I have my team going online and getting these driver's license sent to us. Anything that we can do to help them get on their feet, we do whatever we can do from inside the jail.
That's great to hear. And you bring up a good point about the license, not just a job, but as well, I know where I work, we require a ID for every person that comes through for one of our classes at MAD. And that's also how they can go to their services that they're required to by court. If it's okay with all of you, we're going to switch to our Q&A panel because there are some great questions waiting for all of you. So my first one for the panel is, how many people are currently in the treatment programs, and where are the current gaps in the need in the community support programs and resources? This is from Jim Bowler.
How many people? I'm not a statistic guy. Our numbers are down because of COVID, I believe. Drug court, we probably have, there's 2 judges who do drug court. I have half the docket and Judge Gagliardi has the other half. I'll bet you there's over like around 150 between us. Mental health court probably has around 45 to 50, and veterans court 15 to 20. And those are low numbers because of various issues we have with trying to get people into court. Where are the gaps? I think we've talked about the gaps all morning. The gaps are in treatment and getting people their medicines, and housing and employment, those, all the wraparound services people need in order to be successful. We need more of everything.
Andy, could you also mention, you had shared with me yesterday about the progress that the Salvation Army is making at their new location, or
right.
Their planned new location?
Right. Well, one of my subcommittees, that the court programs, one of the things that we wanted to do was have a homeless shelter here in town based upon the model from Pinellas County. Pinellas County has a wonderful homeless shelter. It's called Pinellas Safe Harbor. And actually, Mr. Brooks is up in Sarasota. He's well familiar with the program. I was hoping to bring that model to Lee County. And what I realized is that, Salvation Army does have a homeless shelter. It's called the Triage Center. It is a wonderful program. But they are building a new facility in downtown Fort Myers, near the baseball field. It's going to be a facility that's going to offer these wraparound services we need. So they're going to provide food. They're going to provide all the services people need in order to get back on their feet. It's going to be much larger than the Triage. I think their population, they're going to be able to hold 400 people. So
I think it's about 400 people. But one of the good things is right now, Triage, we have Triage Salvation Army has 90 beds, and they're going to be moving up to 400 beds to include DOC. But
right.
one of the really good things about the new, because it's going to be basically on the corner of Fowler and MLK, kind of in that area, but they're going to have a family shelter too. So not only are individuals going to be able to be housed there, but they are going to have a family wing. So homeless individuals or those with families can actually go there too. So that's a pretty important part of what they're doing as well.
They're also going to have a day facility for people who are homeless, who don't want to go and stay at night in a shelter. They're going to have a place for them to go where they can interact with people, get services, wash their clothes, get something to eat. So you know, sometimes some homeless people don't want to go and sleep somewhere, but they may come to get the services during the day. So they're going to provide that as well.
Yeah, as well as access to computers, job applications, and things like that. They did have that. So that's one of the important things, because I guess it should be noted that Salvation Army, Department of Human and Veteran Services, you know, on these cold nights, they go out and they do take a bus out to try to pick up homeless people to bring them into a safe environment. And out of, I think the last time they did a roundup, they only had 5 people that agreed to come back in. So these people do not necessarily want to come into a stable housing. They want to stay on the street, and that's what they're comfortable with. So this day program is going to be really beneficial to allow them to come in and get those services that they need, but not have to commit to stay somewhere. So that's a really good point.
And the key there is, they may not be coming to the shelter because of mental health issues, but if we can get them, if you say, hey, come wash your clothes, you know, come eat a meal. Hey, meet PJ Brooks. He'll help you with treatment. He might help you get a job. We want to have interaction with the homeless people, and so that they begin to think we're on their side, and that we're all not looking to throw them in jail and throw away the key.
And that's essentially to build trust.
It starts with one little contact, and that's what we want to get them. It's proven that if you can get one little thing, hey, come in and wash your clothes, come in and get a meal, they start to come back and they start to gain that trust and build that rapport. So it's definitely important to get them into that day program.
You know, I've tried to walk around downtown in my robe and nobody will talk to me.
Lindsay Myers asked, how many permanent supportive housing beds are there in Lee County? I know we talked about beds at night and during the day, but how many are permanent for those who have severe and persistent mental illness? And do we need more?
The second question is yes. PJ, can you answer the first one?
Yeah. We have right now with Castle, and I think we're the primary provider for permanent supported housing in Lee County. I think there's some smaller scale organizations, and I don't want to discount them. We currently have about 90 beds active. We have another we have another apartment that's being remodeled, but in June, Cypress Village will open up an additional 95 beds, which we're really excited about, the apartment complex, Cypress Village. That's a partnership we have with Blue Sky Communities in that development. They're a for-profit organization. We're using what's called tax credits. We're the nonprofit side of it, and we've used federal tax credits to help fund the building of that complex. We've already successfully done one in Sarasota called Arbor Village. It's 88 beds. When we opened our doors in Sarasota, March 17th, COVID time, 70 of the 88 were homeless with mental health and substance use issues. So we've been able to provide that stability. Within that 95 bed apartment complex will be 1 and 2 bedroom apartments. I mean, the quality is going to be great. In fact, Judge Swett was asking me yesterday when we can do tours, and I'll work on coordinating that. It's a model that provides that community setting. There will be case managers that will be on site working with them. And our hope is to keep continue adding apartments such as that. But even with adding those 95, by the way, we have a commitment from the city of Fort Myers Office of Housing and Community Development. I probably said that wrong. They for 75 mainstream vouchers for those beds. So 75 of the 95 beds are going to be funded, which is really exciting, you know, so that people will be able to have a safe place to You know, and I'll share this. This is a sad statement, but maybe it isn't. When we opened our Arbor Village, we had 4 individuals since March who have passed away at Arbor Village. Okay, here's the thing: they came to us. They were in hospice on the street. They were dying. It kind of chokes me up, but they came to us and they died in a safe bed rather than passing away on the street, and that's powerful. Sorry.
It's okay. I'm right there with you. That's amazing to hear that they had a safe place, and I'm glad that our community has a place, and I know that we need to do more, but there are people that were comforted. So I'll transition to the next question. Crystal Johnson asked, just a thought, many of the offenders come from a home where everyone in the home is struggling with an undiagnosed mental health issue. What services and support can these programs offer to the families?
Well, the court system cannot force anyone else to do anything. I can only require the participant or the defendant to do things. A lot of the services we offer will provide services for the whole family if they volunteer to do that. And the community of people with mental health illness is much larger than those that I see. Everyone in town is not with mental health illness, doesn't commit crimes. And a lot of the services that are in town are provided, you know, whether or not there's enough funding because when you come through the criminal justice system, there's government comes into it. Housing for people with mental health issues that aren't involved in the criminal justice system.
The majority of the individuals that we provide, again, we don't have a stipulation court or non-court involved. It's literally the majority. I can say that the vast majority that have come to us from some level of homelessness or imminent risk of homelessness. More often than not, that's how they've crossed our door with our case managers who've done outreach, worked very closely with Salvation Army, the Office of Human and Veteran Services, and others. You know, the Sheriff's Office, Lieutenant Brady has worked with our supervisor of case management, Jenna Alvarez, on a number of cases as well. So I think we're all trying to wrap around. What the key is there aren't enough services. And truth be told, there's just not enough funding to cover the need. Many of the individuals that come to us don't qualify for Medicaid or Medicare. And I can tell you, and Lieutenant Brady will know this, she knows this, it is so hard to get them qualified. The process of doing it is horrific and so lengthy. Sometimes the individual may even give up because it's just so hard. So it's so that funding source, though it's there, doesn't often meet anywhere close to the needs. So the State Department of Children and Families provides funding for mental health and mental health and substance use treatment, but even in that there isn't enough. The county has dollars that they work on, but again, we're kind of gritting our teeth and kind of waiting to see what's happening with this next legislative session, because of the negative impact on tax dollars that are going to be impacted by COVID. And we're just asking, hold us harmless, keep us as we are, don't start cutting, and then we'll get to there.
It's not going to be good, PJ. Following up on that, I go out and speak, do some talks regarding mental health court and all the treatment courts, and people ask me, why do you do it? We do it because the people with mental health issues and substance abuse issues, they deserve it. They deserve to live happy, successful lives. If we just punish them, as I said earlier, it's just a revolving door in and out of jail or in and out of prison. They're going to get out with the same problems and they're going to commit the same crimes. Some people need to be punished. Some people need to go to jail or they need to go to prison. There's no doubt about it. But if we solve people's issues with their mental health issues and their substance abuse issues, they will stop committing crimes. It costs less to solve their problems so they don't commit crimes than it does to punish them, put them in prison, pay for it, kick them out, and then they do it over and over again. So it costs less to solve the problems.
For the next question from David Klein, the community health assessment reports an access issue with Lee County having 99 per 100K population compared to Florida at 150 and the US at 202. Is expanding the workforce the top issue to be resolved? If yes, how should this occur? Is it a training issue? Is it a resources issue? If not top priority, what is the #1 change we should make? Thanks for a great panel.
Is he referring to the workforce for people with mental health illness? If that's
I believe so.
Yeah, then it is, yes. I mean, we need to, everyone needs to have a job. And people with mental health, you know, if we get them the treatment and the resources they need, they're all, you know, people with mental health illness, it isn't people we don't know. It's people we know have mental health illnesses. Your parents have mental health illnesses. Your children have mental health illnesses. Your friends have mental health illnesses. There are people in very substantial positions in our community with mental health illness, and they are operating quite well. So it's not like it's just these lowly people who have mental health illness. So if we get people the services they need, they can work. So if we get them to, you know, but poor people who don't have educations, yes, they need training, they need education. So I think that's a good idea. More job training and getting people jobs will help solve this problem. I hope that answers the question.
Yeah, and to add to that, Judge Swett, you know, just not mental health. We definitely need Lee County to open up the doors as far as employment, to let them and not just put the stigma on the mental health. But yes, the other thing that we need, you know, coming from inside the jail, what we see all the time is we also need Lee County to come together and accept people and to employ them with felonies, because a lot of these people, and that's the stopping ground, I guess, or the stopping point, I should say, is they can't get a job because they have a felony, and people won't hire them. Well, what's going to happen to that is they don't have money, they can't provide for themselves. So what are they going to do? They're going to, again, commit a crime to probably just give them the basic needs that we all take for granted every single day, just to get food on their plate. They may go commit a crime to do so, and then they're going to end up right back into that circle. So as a county, we need to open up those employment opportunities to individuals with maybe a mental health or just with a felony, just with a charge that they might not be able to have a job. So,
or if they don't commit a crime, they'll be on government assistance. Correct.
And so I think this is a great follow-up question from Deborah Camilla. Lieutenant LaDonna, okay. Just wanted to make sure. How can we help the reentry task force, such as money, work, clothes, and as voters, how can we work in the political system to better fund this system?
So with reentry, so about a year and a half ago, I kind of started a committee called the Reentry Task Force. And basically what we do is our group within Lee County and the Public Defender's Office partnered with several community people. We just started reaching out and saying, I need your help, I need your help. Right now we have about 80 to 100 partners in the community. We always need more. We have a donation fund account. So I accept donations, and we use those donations to pay for things like to get them the driver's license, all of the driver's license, to pay for birth certificates, to apply for that. So we definitely need donations from the community. What we also do is we take donations from anything. And if anybody's leaving our custody and they need clothing, they need food, so we'll give them an emergency kit. So we go out, a lot of it is donated, but we will go out and buy non-perishable food items. So our team will actually provide them emergency kit, which will include a mask, some non-perishable food items, hygiene items. We provide them with first aid so that they sanitizer, hand sanitizer, anything that we can give them to help them, we do provide that. What we also do is we take donations, and Lee County Sheriff's Office has been great. They have donated to our program up about 100 bikes. FGCU just donated a bunch of bikes to us as well. They donated 98 bikes to us. So if there is someone leaving, one of the problems that I think it was PJ that mentioned it earlier, is they have no way of navigating the community. They have no way of getting to their appointments. They have no way of going to go to the doctors or go to an employment or get a job. So what we do is we provide them a bike. If we can prove that they're homeless, all these bikes that we get donated, we actually give them a bike. We provide them a front and back light because they can't drive a bike without that. So we do provide them a lot, as well as a lock for the bike so that they can. So those donations that we get, we can purchase those things. We can purchase the lights, we can purchase the locks. For those of you who are in my reentry task force, you know how imperative. I mean, you know, you get guys that walk out and they're getting released at 6 o'clock in the morning, and they're actually, we leave the bike out there for them, they unlock it and they take off, and it is just amazing. As far as clothing, we will take clothing resources. As far as what I'm looking into this 2021, my goal is to have a sponsorship program started. As PJ said, and Judge Swett as well, one of the problems that we have is trying to get funding, trying to get Medicaid and Medicare to pay for these individuals leaving our custody. We are seeing an upwards the number of elderly individuals coming into our custody has risen tremendously. And it is very unfortunate that these individuals have nowhere to go. And like PJ said, he was able to bring those individuals in from the street. But think of when I'm getting ready to release someone and I know that they're going to the street and they're 75 years old, I can't do that. I have to find a place for them to go. I will call upon the community to do so. But the problem we have is funding. So what I want to do is have a sponsorship to where if I have an individual leaving, I can call an assisted living facility and I can actually pay for that individual. I want a group to sponsor and say, I don't want this person going to the street. It can't happen. So I would like to have a funding program and a sponsorship program to where we can get them safe housing. And that's my goal to start this year, 2021, is to have a sponsorship for individuals leaving custody who cannot care for themselves. Because anybody, and we all know that you can't just let somebody walk out that can't take care of themselves. You just can't. And we have to do something as a community to stop that.
I should have mentioned another great community partner as a result of that question. Deb asked that question. The Coalition of a Drug-Free Southwest Florida is a great community partner of ours. And I failed to mention them earlier. I wanted to thank them.
Absolutely, Deb. You are amazing, and we love what you do.
Deb could be a whole program in herself.
Yes, she is.
We will have to do that in the future.
That's a week seminar right there.
One of the questions, this is the League of Women Voters for Lee County. Well, I'm going to pose a challenge to you. I just presented yesterday on behalf of the Community Alliance. We have a legislative program that we did, Sarasota County Community Alliance. It's a large group of human service organizations that all meet to work on the number of issues. And one of the things we do annually is a legislative summit, okay? And we present to our local legislative delegation the priorities for the community. And we target priorities in behavioral health, criminal justice, housing, aging, you name it, developmental, what have you. One of the two priorities in behavioral health is an opportunity to support legislation that would take one of the things that we do in our state is we are a donor state. We are the third largest provider of funding into the Social Security Administration, okay? We're 38th on the list in terms of utilization of those funds, meaning we do not get back what we give, okay? We are funding other states around the country. Well, we also know that the state of Florida does not want to expand Medicaid. It's, you know, that it hurts many individuals, so they're saying we're not going to do that. Well, we also know we're dealing with a funding crisis. Well, currently there's in behavioral health dollars, there's state funding in the amount of about 192 million that goes towards behavioral health that could actually be matched with federal CMS Medicaid dollars that could bring in, and it's no new dollars, it's just existing funding we have, that would bring back to the state about $253 million, okay? It's essentially you match 47 to their 53, okay, percent in terms of dollars. And what the proposal is to do that and have those funds go through the managing entity, Central Florida Behavioral Health Network. There's 7 of them in the state who already know how to distribute the behavioral health dollars. It would actually represent a 30% increase to the overall behavioral health budget in the state of Florida without costing the state any additional funds. And I will be happy to send you what we presented yesterday at the legislative breakfast so that you have that to consider that. I think that there is some ways to skin the cat that we have not fully explored that we could look at without having to put a cost burden on the state. And it gives an opportunity to provide a broader scope of care and to shore up where we're going to be hurting.
Thank you, PJ. We would like to thank our panelists for this morning's presentation, Judge Andrew Swett, Lieutenant LaDonna Brady, and Phillips Brooks. To register for future programs, become a member, or learn more about the League of Women Voters of Lee County, visit our website. And thank you to everyone who joined our program this morning.